Glipizide Er is a medication used along with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. It may also be used with other diabetes medications. By controlling high blood sugar, it helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen the risk of a heart attack or stroke. Glipizide Er belongs to the class of drugs known as sulfonylureas and works by causing the release of your body's natural insulin. The recommended daily dosage and the optimal timing for taking Glipizide Er will be determined by your healthcare provider based on your individual needs. Before you start taking Glipizide, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with breakfast as directed by your doctor, usually once daily. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. If you are already taking another diabetes drug, follow your doctor's directions carefully for stopping the old drug and starting Glipizide. Remember to swallow the tablets whole and do not crush or chew them. This can increase the risk of side effects. If you are taking Colsevelam, take Glipizide at least 4 hours before taking Colsevelam. It is important to use this medication regularly to get the most benefit from it. Take it at the same time each day to help you remember. And don't forget to tell your doctor if your condition does not improve or if it worsens. If you experience symptoms like nausea, vomiting, loss of appetite, diarrhea, or constipation, let your doctor know right away. Also, if you notice an empty tablet shell in your stool, don't worry, it's harmless. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, be on the lookout for signs of infection, liver disease, or low blood sugar. If you experience symptoms like sweating, shaking, or blurred vision, have a quick source of sugar on hand in case of low blood sugar. And if you experience increased thirst or urination, let your doctor know. And remember, this is not a complete list of possible side effects, so if you notice anything unusual, contact your doctor. Before starting Glipizide, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. Also, discuss your medical history, especially if you have liver disease, kidney disease, thyroid disease, certain hormonal conditions, electrolyte imbalance, or stomach/intestine problems. When taking Glipizide, be cautious about the potential side effects such as blurred vision, dizziness, or drowsiness due to low or high blood sugar. It's important not to engage in activities that require alertness or clear vision until you are sure you can do so safely. Limit alcohol consumption while taking this medication to reduce the risk of low blood sugar. Alcohol can interact with Glipizide and cause a serious reaction. Also, be aware that your blood sugar may be harder to control when your body is stressed, like during fever, infection, injury, or surgery. This medication can make you more sensitive to the sun, so it's important to limit sun exposure and use sunscreen when outdoors. If you are planning to have surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially low blood sugar. If you are pregnant, discuss with your doctor about how to manage your blood sugar while pregnant. It's not known if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that could affect how Glipizide Er works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Before making any changes to your medication, talk to your doctor or pharmacist about how it may affect your blood sugar and make sure to regularly check your blood sugar levels as directed by your doctor. It's also important to note that certain medications, such as beta blockers, may prevent you from feeling the usual symptoms of low blood sugar. Make sure to check the labels on all your medicines, including over-the-counter products, as they may contain ingredients that could affect your blood sugar. If you have any concerns or experience symptoms of high or low blood sugar, make sure to contact your doctor right away. If you or someone else has taken too much Glipizide Er and are experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include shakiness, rapid heartbeat, sweating, and loss of consciousness. It's important not to share your Glipizide Er medication with others. Make sure to attend a diabetes education program to learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. You should also learn the symptoms of high and low blood sugar, and how to treat low blood sugar. It's important to check your blood sugar regularly as directed by your doctor. While taking Glipizide Er, you may need to do lab and/or medical tests, such as liver/kidney function, fasting blood glucose, hemoglobin A1c, and complete blood counts. It's important to keep all medical and lab appointments and consult your doctor for more details. The daily dosage and optimal timing for Glipizide Er will depend on your individual condition and response to treatment, so make sure to follow your doctor's instructions carefully. If you forget to take a dose, take it as soon as you remember. If it's close to your next scheduled dose, just skip the missed one. Take the next dose at the usual time. Don't take 2 doses at once. It's important to store Glipizide Er at room temperature, away from light and moisture. Make sure to keep it in a place that's not in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's crucial to do it properly. Don't flush it down the toilet or pour it into a drain unless you're instructed to do so. Instead, consult your pharmacist or local waste disposal company to find out the best way to dispose of it safely. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.